Good evening and welcome to Scope. The delayed onset of a COVID-19 fatality has made the realization of this pandemic very real for many following the emergence of a second cluster of positive cases more recently. Earlier this week, the PNG government announced a 14-day lockdown on the National Capital District following recommendations from the National Control Center.
And these measures come into effect on the 29th of July, which is tomorrow. The first measure, of course, revoked all previous measures issued previously. Measure 2 deals with international travel. The only major change to this measure is that all international passengers will now only fly into PNG from either Cairns or Brisbane in Australia. Measure 3 deals with domestic travel and requires that all flights are required to follow certain requirements as outlined in the particular measure. Measure 4 deals with the provincial coordination. We've just heard from the Deputy Controller. Our best strategy at this point is to map out, and we continue to do so, through testing, what was in the provinces, with NCD included, but at the same time too standing up our response capabilities in the provinces. Greater coordination is needed, because what we do in NCD to contain the spread here will provide a blueprint if this, God forbid, if this situation replicates itself around the country. Okay. If this happens in Lae, at least we've learned from what we've done in Moresby, what works, what doesn't work. If it happens in Hagen, at least we know that what type of appropriate intervention strategies that work or don't work, and so on and so forth. Measure 5 deals with burial of deceased persons. This, of course, is a precautionary measure, and this is needed. We hear and read from time to time about our morgues being filled up, our public morgues being filled up by unclaimed bodies. Let me again appeal to those who have loved ones in public morgues around the country. Please make it your responsibility to claim them and put them to rest. That is the least that they deserve. Okay? Otherwise, you'll see, as we witnessed in Lae, the public health system will be forced to take appropriate and legal measures to empty their morgues. Measure 6 deals with customs duties, and this is specific to any materials, whether it be pharmaceutical, non-pharmaceutical materials, to assist us in NCC to provide and continue to sustain our efforts in defending ourselves against COVID-19. Measure 7 deals with COVID testing. Now, again, we cannot impress on you all the importance of testing. The more we test, the more we know about COVID-19 in the country, the more we know about COVID-19 in the city. Measure 8 deals with the surveillance and testing, and this is more focused on our rapid testing teams. Now, as in the next 14 days of the lockdown in NCD, you will see a greater effort in testing, and these testings are being done by our rapid testing teams. If you are called on, or if you are directed to test, again, an appeal to all city residents, do so. Through that, then we're able to know whether or not there's community transmission in your little communities around the city. And if we do pick it up, then we're able to respond to it appropriately. Measure 9 deals with business and social. So there's certain businesses that have, whilst some economic value, it does not have any social benefit to our interventions in stopping the spread of COVID-19. Business 10 makes it mandatory, as evidenced by myself and the Deputy Controller, to wear masks. I understand this shortly after lunch today, the Divisional Commander for NCD Central, Mr. Anthony Ugambi, and his senior team from Morocco met with the NCD Health Task Force, of which they launched the No Mask, No Service. So as a condition of entry, as a condition of being provided a particular service, whether it's in the shops or in the banks, whether it's hopping on in taxis, for instance. If you're not wearing a mask, then those who are responsible for providing those services have the authority now to refuse you entry. Because not only are you putting yourself at risk of exposure to COVID-19, but you're putting those people who have made the conscientious decision to protect themselves against COVID-19 at risk as well. Measure 10 deals with public transport here in NCD. Now, most of these measures, may I remind you all, are specific to NCD, and it is consistent with our intervention strategies in ensuring that we do our utmost best to contain the spread in NCD. So the Measure 11 again deals with public transport. As of tomorrow, all PMVs will cease in NCD. The only modes of public transport that will continue to operate are taxis, and even then there's certain protocols that need to be observed whilst on board those taxis, and that is a limitation of the numbers in those cabs as well as the masks, as we said. I've also issued directives based on the advice from the Secretary for Education and the Minister for Education and Higher Education, effectively directing that schools close as of tomorrow, the 29th of July, and this closure will continue to the 12th of August.
After the break, NCD Governor Powes Pakop talks to Scope on why it's important to allow businesses to operate under strict guidelines and how the country's complacency allowed a resurgence in cases. The nation's capital has this week had an influx of positive COVID-19 cases, and we spoke to NCD Governor Powes Pakop on how effectively authorities are managing the containment of community transmission, what impact this has on the Bitcoin trade, and why keeping businesses operating is vital.
NCD Governor Powes Pakop, welcome to the program.
Thank you. I'm pleased to be here.
We're in challenging times right now with this whole COVID situation and with the increase in cases. How important is it that city residents adhere to the new orders?
It's very, very important and very critical, more than any other time. Perhaps in the beginning in March, we were a bit complacent. Everybody, maybe national government, our task force, we did not take things seriously, especially to get our people to adhere to the protocol. But now it's a crisis time. The COVID-19 is for real. The community transmission is for real. And the only way we can get the curve down is for everybody to adhere to these basic protocols. Putting the mask, washing the hands, social and physical distancing, isolation, and getting treatment. More particularly, I want to emphasize at this juncture that the reality that we face requires everybody to do and adhere to this basic protocol. The reality is this, and I'll just emphasize it for our people so that they fully understand why it's important and critical. First, we don't have the capacity to deal with a massive transmission or outbreak of the virus in a capital city, or for that matter, in the whole country. In Rita Flint, for example, we have only 70 beds. We don't have a lot of doctors, nurses, and other medical staff. The nurses, for example, we are only getting 60% turning up to work, both at the Rita Flint and also at Port Moresby General Hospital, simply because the families, worried about getting infection. And with the recent trend of the infection, health workers being the first up infected in the city, it's a reasonable basis for the families to be concerned about. So we have limitation in beds, we have limitation in medical staff, and we have limitation too in the equipment. There's not enough ventilators, for example. And the fact about ventilators is this, that it's only effective in ICU condition. Now the ICU condition or the ICU capacity in the whole country is only at Port Moresby General Hospital. And the capacity there is only 12 beds. Only 12 beds. So we are really in a crisis. Government relies on tax from corporate tax, all the import-export tax, all the personal tax, income tax, and from GST. But since March up to now, business has been under pressure, and so we could not raise the revenue that is projected. Government, in terms of funding capacity, I have to be frank to our people, it's getting limited and very scarce. This is the reality we face. So this is why, more than any other time, it's very important and critical to, our strategy and the outcome that we want, that the people adhere to the basic protocol. And they must understand that their health and their well-being is literally in their hands. If they use their hands to put a mask, wash, keep social distance, then it will help a lot in achieving the outcome that we want.
So for a worst case scenario, would we have sufficient testing kits in the city?
Even the testing kits, we are under pressure too, because, we simply don't have enough testing kits, not just in the city, but in the rest of the country. The transmission is probably nationwide already, except that in the provinces, they don't have the capacity to do, sufficient tests. So there's some capacity in the city, and we are testing, and that's why we have this result. Since the state of emergency was lifted, flights have been going in and out, but mostly people going out, people from the province coming in. So if there is community transmission in the city, of course it's gone out into the rest of the country. Since state of emergency lifted, I've gone to Western Province, I've gone to Western Islands, Jiwaka, Simbu Province, Eastern Islands, I've gone to Manus Province. And on this flight, they're all full, packed of people, especially going out. So it's incumbent to the people in the provinces also start practicing the basic protocol. Everybody's just got to do it. Most important thing too, Hannah, is that we must come to terms with the fact that COVID-19 is for real and it's here. There's too much, all this propaganda and people succumbing to all these conspiracy theories, 666 theories, reflect very poorly on us. In the developed countries, USA, in Europe, Italy, UK, Germany, these are most advanced countries in terms of technology, in terms of science, in terms of medicine, in terms of information, communication. Why would they subject the entire nation, including the economy, to lockdown and shutdown and all this if it's not for real? And are we suggesting that all these people who are dying in these countries, including countries like Brazil and Ecuador, the cemetery was full and people killed outside? This is a real hardcore facts.
So with the first SOE, we saw disruptions in food supply for city residents. What are we doing this time that's going to be different to see that doesn't happen again?
The main difference is this, that Hannah and your viewers, what we have in the city and also in the country is that we have two crises. Yeah. We have the health crisis, and which we need to respond to, and we have an economic crisis. In the city now, the advice I've got from our business council is that 64% of the business houses are in a dire situation. If there is more like a lockdown or impediment to their normal activity, they might go over the cliff and shut down. And we don't want to go there because the result of that will be a lot of social problems. People becoming unemployed, they cannot sustain their families. It will be another disaster. So what we have been working out with the NOC and the Prime Minister and his team is that we respond in a way that addresses both crises. So as you can see, they have heeded our advice. So we have not, we don't have a full lockdown. Only the PMVs have been stopped because we've got to stop the movement of people because the virus, as we all know, does not walk or fly or transmit on its own. People move it around. So apart from the PMVs, every other business is still operating as normal, but under strict protocol. Like, for example, every business house now has to have a notice and a rule and a practice that if you don't get a mask, you don't have a mask, you can't get services. You can go to the bank, you can go to the shopping malls, you can go to government department, any other private sector, premises. If you don't have a mask or if you're not practicing social distancing, the business house have decided that they will apply these protocols strictly so that they help for us to contain the virus and at the same time remain open. So this is the major difference. We have not shut down the border yet. The PMVs are still coming from Central Province, so the markets in Port Moresby are still open. So, these two balancing act, we have to maintain it. Both of them are critical and both of them must be overcome.
So with the interagency cooperation, are you also looking at the issue of addressing street vendors, street kids, keeping less people on the streets?
Yeah, absolutely. The less people on the street are moving, the better. Although we want to maintain, the business and some level of normalcy as possible, but at the same time we've got to balance it with the response to the health crisis, and so more people off the street, the better it is for the health strategy to succeed. The enforcement will not be very severe and strict, like police are going to go out and force people. No, they are going to work with the community to get the community to see sense and see the rationale of them self-regulating, self-practicing, so that it becomes a win-win. I think, in relation to your first question, the police perhaps in the first time when we have the SOE, maybe they went a bit tough. But I want to explain again that they went tough because the directive from us was that we have to stop the virus coming in. We have to do all we can to prevent the virus coming in, because if we arrive at the outcome like now, we can't cope. I think generally, from the last 2 days, I've witnessed in the community, a lot of people are adhering to the basic protocol. I'm pleased that people are wearing masks. I'm pleased that less people are moving around. We have allowed the taxi to remain operational because, with the PMV's lockdown, families need to get to the shops and the market. The taxis are there, and we've been encouraging the taxi to be reasonable with the rates so that the people move only because they need to move. But all these people walking around for no reason or just to go and visit the relatives, these 2 weeks, forget about the relatives, forget about having fun and so on. Let's stick to this strict protocol so that we help, contain the spread of the virus.
We'll have more after the break. With close to 10,000 job losses during the state of emergency early this year, many have had to fall back into the informal sector and the million kina commodity, betel nut, which is the livelihood of thousands of our people, could be both a blessing and a curse during this pandemic.
The betel nut issue.
Yeah.
Now, growers to sellers and consumers are all affected. The practice of consumption isn't the most hygienic. So, is there a way that you will be regulating or controlling this?
And at this time, we have not made a decision yet. I prefer that the people come to their sense and self-regulate. This is the time when, our people need to step up and, put aside their own parochial self-interest. Now we need to step up for each other. We need to step up for our city and for our nation. Our people's well-being, their life is at stake. So, our people shouldn't wait for me to declare a ban or tell them that you shouldn't speed. It's common sense. So I'm going to rely on common sense for now. I want to appeal again to all the vendors and the chewers. This is the time when your country needs you, your loved one needs you. The best way we can show love, respect, honor each other, honor ourselves, is to practice the protocol, including not speeding, because speeding comes with droplets, and it is an easy way by which the virus is transmitted.
We have the benefit of learning from other countries and seeing their response and see what measures have been working and not working. Is there any specific, examples that we're taking from?
Well, the main sort of lesson that we can learn is that there will be a massive transmission, and we don't have the capacity. So we cannot use their model in which everybody goes to isolation or quarantine center. We simply don't have the capacity. Like even now, the health workers or our health team are trying to talk about opening the Tarama Aquatic Center. The schools are closed, and we might open some for quarantine or for treatment. We even if we open them, where is the equipment? So we need to think in a different way. So what I've been, and our team at our task force had been suggesting to the NOC and Prime Minister and his team, is that we promote homestay, home isolation, home quarantine, and certain level of home treatment. And I want to encourage our people to do that. People should stay at home and do the basic treatment that we do in dealing with cold. Like in PNG, we know it, our ancestors have done it, our grandparents and parents have done it. We steam. We use all these herbs. It will reduce the infection. And the fact is that from other countries, and the WHO has done like a graph to show that 80% or 85% of people who get infected recover. There is some critical one, maybe about another 5 to 10%, and then there is another like 2% or 2 to 5% fatalities. People can recover. So this is important lesson we can learn. Given our situation, it's best for people to stay at home. Of course, if they're getting respiratory challenges or severe illness, they can call the hotline 1-800-200, and also St. John's on 111. The other lesson we can learn is that in terms of dealing with ventilators, in Italy, when they moved the ventilators away from ICU, use it in open space, it didn't work, because ventilators, they need to operate and they work well in the vacuum air. And that's the condition that exists in ICU. We can't really use ventilators in open space. Maybe we'll just use normal oxygen. And of course, the third lesson we got to learn is if we ignore the economy, we have a bigger problem too. So we got to have this balance. Yeah. I believe we can do it. We can address the two crises together. I think if we all accept that the virus is here to stay, we have to live with it, then we make the necessary adjustment. We can live with it. Like we've been living with TB, and we've been living with measles, and we've been living with HIV and AIDS. HIV and AIDS is probably more deadly than COVID-19. And we have managed to reduce the prevalence. We've managed to reduce it from a generalized epidemic to localized pandemic. So we have a good record in responding and dealing with such major challenges.
Governor, my final question. For some reason, we aren't having high mortality rates like other countries. Are we also looking at putting funding into this data collection and research, I guess, to try and understand how we've been able to survive?
That's something we have been asking WHO and our medical scientific team to do and come up with. I understand they are working on that. That's a positive, part of what we have achieved up to now. In the last 1 week, we have been monitoring all the mortuaries and funeral homes, and there is no spike. So that's good indication. And if we all respond together in the way that we have proposed and prescribed to everyone, I think we can maintain it that way. The priority should be given to those who have underlying conditions, those who have TB, those who have HIV and AIDS, those who have diabetics, maybe elderly with maybe high blood pressure and so on. These are the people that should be given priority to go to Ritaflin or any other capacity that we set up. Everybody else, if it's mild, we're encouraging them to stay at home. Isolate yourself at home. Another point that is important to Hannah, I want to raise is that stigmatization. What I want to say to everyone is that this is a time when we show love and compassion and empathy to each other. It's not a time to stigmatize or shun people. People who have been infected, they're already under stress. They are worried about what's going to happen to them. They are isolated. They can't go out and get food. They are confined in Ritaflin. If it's, for example, one family that got infected, then who's going to help them? So what I want to say to our people is to take cue from what happened to this woman in East New Britain. When she got infected, the community came and gave food to them because she couldn't go out, she couldn't fend for herself. So at this time, if your neighbor get infected, they're not going to go out and buy food. So they need you as a neighbor, as a fellow Papua New Guinean. We all profess to be Christian too. This is a time when we show love as a Christian or as a residents of our city or fellow Papua New Guinean to each other. Care for each other, and all of us need to come together to support each other, support ourselves, so we overcome this challenge. I'm confident that we can overcome it. Yeah, we've shown it before. As I said, we faced a lot of these type of challenges, and we have survived and we've come this far. We can definitely overcome COVID-19.
Thank you very much for your time, and we look forward to having you on the show again.
You're welcome.
Thank you for tuning into Scope. Join us again next week. I'm Jemima Sugbat. Goodbye.